Hello and welcome. Mental Health Recovery Series. Oh, the Institute for Psychotherapy, Psychiatry and Psychosis. And we're going to do depression and recovery. So, depression and how people recover. So, a bit of understanding from what's the core of depression for people, the framework of recovery and modalities that people use within that. Within depression, there's a continuum, okay, and go down the continuum, and then you get up to a point where a person goes through almost like a boundary or barrier. So just going down that severe end. I'm defining that end as severe or clinical depression. And these things are defined differently by different people, you know. And when you're down that end, you're a person who wants to close the curtains over and lie down. That's it. And this is a call from the system to convalescence. That is what it is. It is the system saying to you, pull over the curtains, lie down, and convalesce. And if you follow your system, and this is a key in mental health recovery, you will be okay. If you don't, you know. And when you're down that severe end, and that's what I'm saying, is characterized by that, it is an overwhelming sense of I wish to pull the curtains and lie down. That's where we're at. That's what we're looking at, this part of it. And what happens with people who follow that, they follow their system, is that within a year, the vast majority of people are okay. And within 2 years, the vast majority are far better than okay. And that's it. That is it. You're done and dusted. It's over. And what happens is that some people listen to the system and do it, and that's how it works out. There are other people who have people in their life who say, you know, listen, you're in trouble here, you better go and do something. And they are strong enough to go, no, I'm going to listen to myself. And if you try and push me on that, you're gone out of my life. You get a cohort of people like that. And those people are okay too. Within a year, they're okay. And within 2 years, they're grand. Then you get the people who unfortunately went into that state and were unable to, or listened, or was forced to go and get intervention, usually biopsychiatric drugs, and you're fucked. Because I'll be talking to you in 25 years from now, most of you, and it'll be, your life has been like a vacuum. I mean, nothing. Or it's really sad and tragic. And had they listened to you and left you alone 25 years ago, you would have been okay. And I'm very sorry that that's what's happened to you. When you come back from that veil and up this side of the continuum, you have people who, you know, we use words like I feel depressed and this, that, and the other. And, you know, it's really defined by how you're feeling, because that's what depression is. Core depression is about being overwhelmed by feelings or shut down. The core of depression is about emotion. That is what it is. So on this part of the continuum, you know, God, feel awful, terrible, no energy. The model of recovery is this vast majority model that's used in mental health, is self-directed recovery. Okay, you'll hear this continually throughout this series, really. And in this, there's two characteristics. You say to yourself, okay, you know, I'm in trouble here. What feels right for me? Openly, honestly, what do I need? And fair enough, people listen to other people, but I guarantee you the second thing that's shared is that the person runs what they hear from others through themselves to see if it's appropriate. Does this seem appropriate to me? And if you go with the expressed opinions of others without checking with yourself, you're going to get into serious trouble, up to including never recover. And when people are in this part of continuum, people use many, many different modalities of recovery. So that's the framework we've just discussed there. Now there's modalities. Most common modality that people will say they use is walking. They go for a walk, not fast, not slow, not medium, just above medium twice a week, 10 to 15 minutes. And that's the modality most commonly used. Well, we have a beach not far from where I live. And you'll go out there and you'll see people, and that's what they're doing. They're out dealing with their mental health, and it's very effective for them. Well, come back in a couple of years, come back in a couple of months, and you see people are completely different. They do what's right for themselves. Other people do various different sorts of stuff. You do what feels right for you. Some people look at their diet. Some people look at their home life. Some people go, what do I need to do? I need to get the fuck out of this fucking relationship. It's fucking killing me. No wonder I'm depressed. Or whatever it is. It's different for every people. Some people, I suppose, because and although the core of depression is related to emotions, it doesn't mean that you talk about them to solve them. If you want to, and if it's right for you, if you feel yes, you do, and that's what I do. I accompany people and listen, be with you. And when we get into, and I'm saying this for people who accompany people here, be very careful. We get people coming to us in real deep despair, and you just have to be present with the person and allow the person to journey through that. You don't deepen that. You just be present with the person. And we'll obviously in my work get a lot of people who are professionals who come, and this is where we get into difficulty. Obviously, the use of medication. Medication is, it's up to you, but vast majority of it is crap, and it's a pathway to chronicity. And it makes money for people who produce them, and psychiatry doesn't want to listen. That's what it's about. And in the process, it flushes people's lives down the toilet in general. Although for you as a person, medication may satisfy you. If you do, that's fine. If you're the person who goes, yeah, I need to do this, well, then you do. Obviously, you follow yourself, and you then learn about how it's come off and side effects, etc. And you be very careful. And when you're coming off, you do it. You make sure you know how to do it. But we'll get professionals. The examples that I use in these series, none of them are confidential. Where we would get professionals who come in who would have explored the psychotherapy or angle of it, and would come in, and you would get a middle-aged man who's big into Lacan. Lacan is a post-Freudian. What it is you will get in this area people who have retreated into their heads. So therefore, what's happened is that they no longer feel anything. They just think it. They're thinking. It's all about over-intellectualization. It's called the schizoid position, or one of the names for it. And what you'll have, the image you get working with usually a man like this, is a person who's about 7 or 8 years of age, who's sitting down in a room with walls that are 6 foot thick. And pasted on the walls is that I have decided never to feel again. And that is the depth of pain which some people who are going through this are in. And again, I remember a young woman coming in, also would have worked in a profession, and just inviting her to share with me what depression was like for her, and she burst into tears, because she became overwhelmed. Even the invitation to express how it is for me can be overwhelming. And in the case of this young woman, is that she had obviously placed herself into a situation where she knew she was going to be accompanied in this way, and she knew that she was going to be overwhelmed. And sometimes a person does need that. But if you're accompanying somebody and you force somebody into this, you will harm them, and you will harm your alliance with them. Be very careful. So I'm saying this for those of you who are family members primarily, who think I'm going to get this person through by getting them to feel, or the psychotherapists who are beginners who think if I ask enough questions they'll have an insight and live happily ever after, which is a fucking lie. Your job is to be present and accompany. That's your job. And you'll see how that gentleman referred to defending against violence, you'll see how this can overtake some areas, for example, in parts of biopsychiatry and clinical psychology, counselling, etc., where you have cognitive behavioural therapy, which this woman would have been associated with. And what cognitive behavioural therapy is a defence against feeling. So what you do is you cover it with, we'll talk about thoughts, and then we'll talk about behaviors, and we'll wrap this up, which is what it's about. We'll wrap the core thing up, which is our feelings, and we'll defend against them through creating a whole way of working, which is about defending against the core issue involved in our issues and problems and depression. And there's nothing wrong with that. I'm not going to, I mean, this one young woman who came in with that sort of attitude was profoundly hurt and wounded. I'm not going to judge her. What I will judge is when professionals say that this approach has something to do with depression and understanding. It doesn't. It's about defending against feelings so that you can work. So, for example, I would have been, remember, I was at this thing with a woman because with the UK, I was visiting the UK, I'm not from there. And it was a workshop, and I was working with her, and she was a woman in late 40s, worked in the NHS, would be a clinical psychologist. So I began working with her, and within 15 seconds she burst into tears, and she said that she had never been listened to before. So this is a woman in her late 40s who's never been listened to, who has worked with other people for 25 years in terms of their mental health difficulties. And she will not have been present or listened to one of those people because she herself has never been listened to. So this is where things get very difficult. We need to be very, very careful how we work with people and how you listen. And it's very pronounced in the area of depression. For those of you who are struggling and those who are accompanying, the way of liberation is self-directed recovery. You what you feel is right for you. When you listen to others, you make sure as you run it by, does this feel right? And if you're accompanying, you be present with somebody. You can't make them better. You can't force them to get better. You decide, will I be, am I going to accompany? Am I going to be present? And if it's not for you, well, then you leave. And for those of you who are really struggling, and it's a terrible place, it's a terrible, terrible place. And when you're in that real darkness, in those places of just complete despair and overwhelm, I want you to know that I'm there. Smoke a